I'm a big fan of, like I said, food is medicine and eating a healthy diet. But I want you to also know that the body recognizes an excess of vitamins, and it's smart. When it doesn't need too many, it urinates it out. Okay, so you can try taking all the vitamin C in the world that you want, and it might make you feel better. But if you have a certain excess, then it doesn't matter.
Hey guys, thanks for tuning into this episode of Mom Talks with Christa. This episode is all about COVID-19. So I've been getting a lot of questions from moms about pregnancy, breastfeeding, and everything else parenting related during this kind of crazy time that we're all going through right now. So I pull in a professional that would know exactly how to answer these questions. So I found Dr. Amna Husain, who is a pediatrician and lactation consultant, and I asked you guys to send me your questions about COVID-19 as it relates to parenting, breastfeeding, pregnancy, and birth. And so I share these questions with her, and I'm just so grateful for her to come on and, share some of her knowledge with us. So this is a very informative episode, and I thought it was super important to get it out to you guys as soon as possible. So without further ado, here's the episode. Enjoy.
If you want to just start and just tell us a little bit about your background, what you do, and we'll kind of go from there.
My name's Dr. Husain. I am a pediatrician. I'm also a lactation consultant. I'm a mother to a 2-year-old, and I currently have my own practice here in New Jersey. It's a direct primary care practice, so patients kind of pay like a membership fee, and it's kind of similar to a gym membership. So they have, direct access to me, phone, text, anything, and I do house calls as well for them. So it's a little bit more of sort of modern medicine and meets the millennial mom with a bit of old-fashioned medicine thrown in too.
It's very unique. I haven't heard of that before. So that's awesome. So today we really wanted to bring you on to talk about COVID-19. Like I was kind of saying before I started recording about, I'm really getting so many questions from moms about COVID-19 and how it's obviously changing so many people's lives right now. So there's a lot of concern, a lot of questions. So I reached out to our audiences and asked what their top questions were right now. And so we'll kind of just go through those one by one.
Sounds good.
All right. So the first one I have is, what's the best way to protect yourself against the virus?
Sure. So we can't say this enough, is really hand washing is incredibly important. It always has been. It's not like this is just something new we've discovered. It always has been incredibly important. Definitely, we work in the medical field, so we constantly are washing our hands all the time. I've never really had long nails, and that's just for hygienic reasons. And I think people are now just starting to really think about it again and be like, oh, okay, yeah, I need to wash my hands every time before I eat a meal. Those are just good things to do in general. So, if you're ever wondering about when you should, or how much is too much washing your hands, or is it enough? The CDC gives great guidelines. I also have a video up on IGTV, but the times to do it would be before and after you prep a meal, before you eat, after you take out the trash, of course, after you go to the bathroom, after you're handling other people's bodily bowel movements. So like, if you're changing a kiddo's poopy diaper or taking your pet out for a walk, those are times to wash your hands. If you're, cleaning a cut, those are times to wash your hands. And now we've also thrown in additional times in there. So before and after you handle your face mask, before and after you get home from the grocery store. So it's really like that's key. Then the second key component here is really staying away from what I call, the T zone. So your eyes, your nose, and your mouth, because really viruses have to get in some way and really then start to replicate and take over. And if you think about our children, what are they constantly doing in daycares? And they're picking their nose and they're sucking on their fingers and putting toys in their mouth. That's kind of how they keep getting these same germs. Adults too, who don't wash their hands and then are constantly touching their face. This is how we get germs. So if you just do those 2 key steps, that's really important just in general to really protect you going into cold and flu season. And now with this pandemic, we are really advising you to try to shelter at home as much as possible so we can decrease transmission. So that's another way that you can really do your best to try to stay, as safe as possible. And I want to really put in a plug here that a lot of people think that there's a magic pill they can take. If I just take high doses of vitamin C, or if I just do like this immune boosting supplement, it'll all be better. And I really think it's important for us, especially in, the US, we're a very food focused society, and food is definitely like medicine. I sincerely believe it, but there is no quick fix to this. You don't necessarily need to boost your immune system. Your immune system does just as good of a job. So things that you can do though to really stay at a high functioning immune system is get enough sleep. We have evidence that even as low as 6 hours of sleep can really decrease the functioning of your immune cells. Making sure you're eating a varied diet. And if you do eat fruits and vegetables, you're going to be getting in enough vitamin C and vitamin D and zinc as it is. Making sure that you are exercising. All of us have a lot of free time as it is, but some good amount of exercise during the day really does help with blood flow and cardiovascular strength. And then lastly, just try to drop your bad habits that you have now. So if you're somebody who smokes or vapes, this would be a really great time to stop doing those things, because we know we have evidence that those kinds of things can really impair your immunity, and even heavy drinking can really impair your immune cells. So all of those things, which I think are pretty easy to really focus into our day-to-day lives, can protect you so much from anything really going forward.
Mm-hmm. Awesome. That's huge. I know I didn't put this on here, but I just wanted to ask you too. I've been seeing a lot about so if you do start to notice symptoms, people are saying don't take ibuprofen, take something instead. So is that's been reported as you get negative side effects?
To explain what we know is that the health minister of France put out, I think it was a tweet actually, and then he put out a statement that said he is noticing in his country that taking ibuprofen might cause a protracted or a longer course of the virus and the viral disease. Now, here in the US, we took that data, and that was when the cases were rapidly happening. So this has been now probably about 2 weeks since that data has kind of come out, 2.5 weeks. And we kind of saw something similar anecdotally, that some patients, they did just fine and they took their ibuprofen and no big deal. And then some patients didn't do so great. Do we think we know why? Not exactly. There's a couple of different theories out there. I would say that if you're pregnant, ibuprofen's not safe anyway. But if you're not pregnant, if I were to get sick and I was worried about this, I would kind of stay away from Motrin just out of an abundance of caution. Who knows if I have COVID-19? I might just have the common cold. Mm-hmm. But I would, just out of an abundance of caution, just stick to the Tylenol as needed for the muscle aches and the fever reducing symptoms. We don't quite know, and I wouldn't call it fake news yet, but I would say that we're just seeing anecdotally. And anecdotally means in small numbers, not something that wide, vast spread that we're seeing ibuprofen across the board is really harming.
So I have a question in regards to my 6-month-old and coronavirus. If I take vitamin C to build my immune system so that I don't catch coronavirus, am I still getting the antibodies that she would need? Or would it be better for me to not take vitamin C and make sure the antibodies are strong in my body rather than the immune system than relying on the vitamin C?
This is a super complicated topic, and I'm going to break it down because this individual is getting a couple of things confused in one. So I've said before, your immune system is healthy. It doesn't need boosting. I'm a big fan of, like I said, food is medicine and eating a healthy diet. But I want you to also know that the body recognizes an excess of vitamins, and it's smart. When it doesn't need too many, it urinates it out. Okay, so you can try taking all the vitamin C in the world that you want, and it might make you feel better. But if you have a certain excess, then it doesn't matter. Same with, let's talk about elderberry, because I've gotten a lot of questions about that. Look, the data we have for elderberry is minimal, and it's really only in regards to flu. So not SARS-CoV-2 or COVID-19. Really, the things that are going to help you the most are those same things: hand washing, not touching your eyes, nose, mouth, sleep, exercise, healthy diet, quitting your bad habits, trying to lower your stress levels. All of those things, that is actually very good data that we have on those things. And they're simple to do. So that's your immune system in one. Now let's talk about the antibodies. So antibodies are formed by the body in response to an antigen or an infection. there's two ways to really get the antibodies. Multiple ways, but I'm going to make it as simple as possible. So one is getting the infection, and then your body develops the antibodies. Or two, what we call passive immunity, which is getting vaccinated and then developing the antibodies. And as you can imagine, the immunizations is a safer way to do it, because if you contract measles, yeah, you'll have antibodies to them, but there's a risk of having death or encephalitis. Same with COVID-19. You might recover and do really well and be fine, but you might be one of those unfortunate individuals who's intubated or who ends up passing away, because it's a spectrum, right? So we think that getting the vaccination, we know that getting the vaccination is a safer way to develop antibodies. So that's the antibodies question. So vitamin C does not affect the antibodies. The antibodies come into the body by coming in contact with some part of the virus or the bacteria. So either getting it or getting it in the way of a vaccine. So it's inactivated, killed, safe. So you taking vitamin C will not affect your antibodies. In regards to now nursing, you don't have to worry about that. Your body will, if it gets in contact with the virus, will produce antibodies, will pass it to the baby. Vitamin C will not affect how strong those antibodies are, and it won't affect the delivery or the quality of the antibodies. So a couple of different things right here, and I just wanted to break it down and separate those topics.
Yeah, no, that was so helpful, because even if as I was writing it out, I was like, then I was thinking about it, and I was like, oh, would that be
right? I mean, everybody thinks, and I get it too. Like I'm potty training my daughter right now, and I wish there was an easier way to do it. And I think we just wish that exists and that should be there right now. But sometimes there's just not easy fixes. And vitamin C, that's great, but you have a great immune system as it is. So unless you're somebody who's fighting an autoimmune disease like celiac or rheumatoid arthritis, you don't really have to worry about your immune system being crummy or needing boosting.
So how do you go about telling, because I've seen this from multiple friends, I've seen people post this, excuse me, as well, about certain family members not taking it seriously, still wanting to come over, or, still seeing them go to the store multiple times a day or a week. So how do you approach that?
Yeah. And I'm in New Jersey, so I'm in one of those really big hotspot states, or right next door to New York. It's less here, but I certainly see it all the time on the news in California, in Texas. I mean, in different spots in the Midwest where we're just not seeing it as fast, that people don't really get how serious it is. It's hard. It is, I think, because we really don't want to. Emotionally, it takes a toll on us to see our family members not taking it seriously, or our friends, but we also, it's exhausting. And right now we're running on such low energy as it is, as mothers and parents, trying to homeschool, trying to do what you can. So I would handle this in two different ways. One, just try to cautiously keep advising them. You don't have to put it in their face. Just slowly be like, well, right now we're trying to keep things on a minimal basis. Well, just stick to what you're trying to do in the house. Nobody can force you to do anything you don't really want to do. So if somebody's trying to guilt trip you about a play date or something, nobody really has the authority to do that right now. It's about your comfort level at this point. And honestly, you should have this relationship with an open lines of communication with your child's doctor and your doctor. So listen to what they're telling you, listen to what the health officials are telling you, and what your gut is kind of telling you at this moment. Secondly, it's unfortunate, but I think we're getting into a point now where honestly, somebody knows somebody who has been affected by this directly. I have family members in New York who've been affected. I have friends on the West Coast who've been affected. My husband has family members in Michigan who've been affected. I'm sure somebody knows somebody whose neighbor was affected. So this is not just we're just hearing about random cases anymore. This really hits home personally. And I think that's really starting to scare people a little bit and make them realize that this is real. And then lastly, just seriously, it's not worth your time and energy. You say what you want and stick to what you want, but if people are going to believe what they're going to believe, and I see it even as a pediatrician, right? We believe in the power of vaccines, or we believe in the power of, positive parenting, or we believe in certain, and if somebody wants to do that, you can't really you can't really change their mind once it's made up. And so you really have to focus your energy in a positive way, especially during these trying times.
Yeah, I think it's like we want to control like what we're doing, and then like see everyone else, and we want to control that too. But it's like at the end of the day, we can
only control
really
so much.
Exactly. Definitely. So I keep seeing things posted about this as well. Are children less likely to get COVID-19?
Good question. So there's some data that people are saying children are immune. They're not immune. So disclaimer, they're not immune. There's a couple of different theories out there why we think children are not as affected. One being that the coronavirus is a family of viruses, and you probably have heard this before, and COVID-19 is a novel coronavirus. But the other coronaviruses, our children see them all the time in daycares and schools, so perhaps they have some cross immunity, we think. One theory. The second theory is the virus affects a receptor. The SARS-CoV-2 virus affects a receptor, and children don't have too much of that right now. We don't think they have very high expression. That's a second theory. And thirdly, this theory is that we know that elderly individuals, their immune system is not as robust. And they're more likely to get sick. When they get sick, they get very sick. Children, on the other hand, have a little bit more of a stronger immune system, if you could kind of use that dichotomy. So we think perhaps they fended off better. So those are the three theories. The one I like to think about that why children are as affected as much is the one that they don't express that much of that receptor in their lungs. But I think it's important to look at the facts, and that's the doctor in me that comes out. But there's a study out of China that showed about 2,000 children, and I think 6% of them had no symptoms, 90% of them had like the mild cold symptoms, and 4% had very severe symptoms. And those individuals were very young children, close to infants, the people who you'd expect to have very fragile lungs at this point. But that just goes to show you that yes, children can be affected, but children are going to have symptoms of likely the mild cold. I think I've seen it in children here in New Jersey that I've taken care of. I've never physically sent anybody for testing because, as you know, there's like a huge testing shortage. And these were patients who I was comfortable enough that they could be managed on an outpatient basis. But I want to just dispel that myth that children can get it. They're not immune. They probably might be the ones who are carrying it because they could be asymptomatic or just have a mild cold. And how often do our kids go and touch things everywhere? So just make sure, you stay safe. And the kids I'd be the most really cautious about are children with chronic care needs, children who are immunocompromised, so my Crohn's patients, my type 1 diabetic patients, children who are on chemotherapy, infants, and then children with asthma. Just off the top of my head, those are going to be the people who, if you're a parent to one of those children, just, keep open lines of communication with your pediatrician.
That's very helpful. Yeah, because there's so much information out there that's
big news, I know,
contradicting, and you're like, what do I believe? So if your family member has no signs of COVID and is safe, is it safe to have them come see your 1-month-old?
This is a hard question for me to answer. And I try to, as a pediatrician, put myself in the place of my patients. And, especially with the restrictions going on with pregnancy and labor and delivery lately, my husband and I talked about that. We're like, how would we feel? That would be really hard. So I know this is really hard when you have a new bundle of joy in the house, a 1-month-old. I think this is a decision that you really have to weigh the risks and benefits of. This is definitely not a normal time for anybody, but if you have elderly family members right now, your grandma and grandpa want to come visit, I would say maybe hold off. Again, this is the risks and benefits. So are you doing it for the benefit of yourself, or let's think about the benefit of the society as a whole? This time will pass. I know it will. And I have really tried to talk and check in specifically on my new parents because, there's a new parent anxiety that we all know about, but then there's a COVID-19 anxiety that's really kind of taking over everything. And you think maybe this isn't a big deal. Who do I go to for help? That's why I'm checking in on those families more. So I would say nobody can force you to do anything or not do anything, but really just try and use common sense at this time. And maybe it wouldn't be the best time, especially if it's not essential.
Okay, definitely. This one's about breastfeeding. Should you be weaning during the outbreak? More specifically, would it be beneficial to still be nursing in case you did come down with COVID to pass along the antibodies?
Yeah. This, she hit the nail right on the head, this person with the question. So I wouldn't advise weaning unless you and the baby want to wean for any reason. There's two people in this relationship. So if, your child doesn't really want to nurse anymore, then sure, that's a different thing. If you don't want to nurse anymore, that's a different thing. If the stress is really messing with your supply, sure, that's a different thing. But there's no reason medically to wean during an outbreak. And secondly, yes, so we know that if a mother contracts the flu, let's say, and her child is too young to be vaccinated, she can still nurse and pass along the antibodies. But the things that you need to do, I'm going to use flu for example, but if I'm a mother and I am nursing a 2-month-old or a 3-month-old who's too young to be vaccinated, wash your hands, wear a mask, and then baby can nurse. I think it would be better at this time, and this is what we're advising for the COVID-19 positive mothers, to pump and someone who is well to feed the baby. I get that that's a very hard decision for some mothers who want that bonding experience coming from somebody who did exclusively pump. It's so hard. So the other option then is to wash your hands, respiratory etiquette, wear the mask, and then nurse.
Awesome. Very helpful. If you have it and breastfeed, will your baby be immune or at least have a stronger immune reaction? Or if the baby gets it and you don't, will your breast milk be beneficial other than the normal benefits?
I think there's very little data to say that this is going to be much better to breastfeed right now for this virus than any other virus. That being said, the normal benefits, I don't think we can underscore that enough. You would get on an everyday sort of weekly basis from nursing. Those are really important. So what I'm trying to say is I don't think that if you aren't nursing right now, your child's going to be at a much detrimental loss, or it's going to be much more dangerous or anything. If you are nursing, know that what you're doing is already fine for the baby, but it's not going to give him super immunity against just SARS-CoV-2. If that makes sense.
Definitely. We also were getting a lot of questions about COVID and pregnancy. We also have a mom Facebook group where a lot of them are pregnant right now and share a lot of their concerns. So this one is, what extra precautions should a mom take that is currently pregnant?
Yeah, and I have a few friends who are pregnant too, a couple of people who work in my office. So I think you're going to see a wide range here, depending on where you are. So some physicians and OB-GYNs are still doing visits in the office, but doing, the extra precautions, hand washing, 6 feet apart, as much as they can in the waiting room, masks on, and still seeing you. Some doctors have really shifted to almost all telemedicine for OB-GYN care and only having you come in for very important visits like a scan, or if something is not going well. That's something more of what I'm seeing in New York and in northern New Jersey, where the cases are very high. Some doctors are really advocating more on a stricter note about how delivery is going to happen. And again, you're seeing that more in the tri-state region where I am and on the East Coast. So it really depends on your practice's policies. I would say that if I was a woman who was pregnant right now, this is what I would do. And I kind of do this kind of sort of real talk with my patients, because I want you to know that there's only so much that I can advise, but I want you to know how I would go about it. So I would wash my hands as much as possible when you need to be, doing all those smart things that I mentioned, wearing a mask if you do need to go out, but try to shelter at home as much as you can. If you do need to go out for your appointments, right? So pregnant women need blood work done, pregnant women have scans coming up, especially depending on how far along you are or how high risk your pregnancy is, you do have to go frequently sometimes. Try to get everything as possible to be on the same day. So if you're going out on Tuesday for your scan, don't do your blood work on Friday. Really just talk to your office and be like, I'm leaving the house at this time, and I really don't want to be out that long. Can I just get everything to be compiled into one time? They should really work with you on that if possible, so that you're really limiting the time that you're going in and out. Other thing I want to say is a lot of pregnant women in pregnancy are worried about being immunocompromised. And I don't think you are immunocompromised in the way we talk about people who are on chemotherapy or that kind of thing, but you are in a state of lower immunity because your body is growing another human. That's a beautiful thing about pregnancy. So just make sure you're taking the right precautions. So you should maybe not be trying to run out in the middle of the week multiple times a week to the grocery store. If you're working, I have a friend who's a physician and she's pregnant and she got COVID-19. She can't do anything really about it. She's on the front lines in New York working. But if you're somebody who has like a desk job, or maybe you're somebody who works in a grocery store and you're in high contact with people, ask, like, maybe you could do something that's more of a desk job. Maybe you could do more of the admin work so that you're not in super high contact with people.
Mm-hmm.
That would be something that I would really advocate for if I was pregnant at this time, and what I would really try to do at this point. A couple of other things you asked about, what extra precautions. So I think this is where keeping a good open line of communication with your doctor is important. I know a lot of women are wondering if maybe a birthing center would be the right thing to do at this time because of the restrictions in place about potentially your spouse not coming. And if I could just talk for a second about that, I think that is so hard. Like I said, my husband and I have talked about it and we're like, God, I don't know. That would be so hard to not have that person, your other half there for such an important moment in both your lives. And I want you to know that you're a huge priority in the hospital. We want you to have a healthy delivery, but we want you to have a safe delivery, and not just you, but everybody on the ward. And we would hate for someone or someone's baby to potentially be exposed to COVID-19, not to mention the staff. I mean, there's reports of entire practices of OBGYNs coming down with this and having to be quarantined. And then it comes to the problem of safety. Who delivers your baby? So we really have to think about everybody's safety here. Lastly, I would encourage you that if you're doing, looking into a home birth, there's certain times where you're not really a candidate. If you've had a prior C-section, if you have gestational diabetes or some kind of complication, those are reasons why, we want you to be on the safe side. And 10 to 40% of home deliveries do end up needing treatment and needing transfer to the ER or to the hospital. And you have to think about who's coming to pick you up, EMS. And EMS is spread so thin, guys, here in the Northeast. So just these are really important things to think about, that if you need to escalate care, is 911 going to be able to come? And when it comes to newborn resuscitation, it's minutes, it's not hours. And I can say that as a pediatrician, it's seconds and minutes that matter. So I don't want to scare anybody, but those are the things that I would really be thinking about. And then if in this time of social distancing, if you're going to bring a midwife or somebody into the home, is that person also practicing social distancing? So we have to really depend on everybody kind of playing their part at this point. Mm-hmm. Or are they coming from a crowded home birth just now where 10 people were in the home? So this is really not an easy time. And I want you to recognize that. And I think that these precautions are in place until we really flatten that curve. And then I hope they go away. Because we want you to have a safe delivery. And I want you to know that the nurses and the doctors in the hospital, they have a heart, and they want this to be the best moment they can make it for you while you're delivering at this time.
Mm-hmm. Absolutely. That's awesome. I feel like that will be just very helpful to hear, a lot of moms to hear, because I see so much anxiety in our group right now. So what can they expect if they're about to give birth during this time?
I'll talk about this in a couple of different ways. So let's say you arrive to the floor and you don't have COVID-19 and you have nothing and no symptoms whatsoever. They're still going to take your temperature. They're probably going to ask you a couple of questions. When the Ebola pandemic was going on, it was actually epidemic. It didn't really spread to the US. They asked you questions about, did you travel from any Ebola? So they'll probably ask you the same questions. Did you travel here? Did you do this? Have you been in contact? Have you felt sick? They'll ask you all those good questions. They'll probably try to minimize who's coming in and out of the room, which is actually going to be probably working to your benefit because you don't have to see so many people. And when it comes time for delivery, your doctor will still be in there. Your nurse will still be in there. They'll probably be wearing a mask just to be on the safe side, because again, this is droplet transmission, person to person, but here we're delivering an infant, and we all know that there's blood, there's placenta, there's amniotic fluid. We just want to be on the safe side. And like I said, we have to protect our healthcare workers, because we are going from room to room, person to person, and we never want to be that vector who transmits the disease. So that's why equipment is so important for us. So that's if you don't have COVID-19. And hopefully your baby will be able to room in, and you'll have a fine, uneventful delivery, and you'll probably go home within 24 to 48 hours. Now, let's say you come into the hospital and you're COVID-19 positive, or you are potentially under investigation because you're having fevers, or you're having shortness of breath or a cough and your test hasn't come back yet. This is what we'll probably do. You'll be put into a room. If your delivery requires the NICU, let's say you've had a prior C-section, or let's say baby's too small, or let's say you're pushing and the baby just hasn't come out yet, or there's a fetal deceleration. A couple of reasons that the NICU team can come by. The AAP has advised that those people need to be in proper protection as well. So if somebody does come by who's in a resuscitating team, know that they'll be wearing a mask and equipment as well. If you're positive, we're gonna probably talk to you and say that the safest thing to do right now for your infant would be to separate you and your infant and probably put your baby in the nursery. And then we have to think about keeping the other babies in the nursery safe too. So we'll probably have that conversation with you. Nobody's gonna do anything without chatting with you first, okay? So that's really important. Some mothers might say that even though I know it's better for the baby to not be near me, I want the baby to be in my room. And in that case, we still advise that the baby be 6 feet apart. Okay, so the AAP has put that data out. Now, again, these are for moms who are positive for COVID-19. I really want to ensure that nobody thinks that, their baby's going to be separated from them. Mm-hmm. If you breastfeed, we encourage nursing. If you nurse, we're going to do those same things. You wash your hands, you wear a mask, then you can try bringing baby to breast. If you are separated from the baby, you wash your hands, you wear a mask, and you pump, and somebody well feeds the baby. The nurse might feed the baby. So they're still getting your pumped milk or your colostrum, but they're not getting it really that close to you so that they could potentially contract the virus. Mm-hmm. We'll probably try to get you out again within 24 to 48 hours. And this is where it gets a little tricky, because as soon as you go home, I'm not going to pretend that you aren't going to be within 6 feet of your baby. So it's hard. We do what we can in the hospital. What we advise for mothers who are positive is to use the CDC criteria to know when you're no longer really suffering from the symptoms. So that's 3 days without fever, 7 days since the onset of the first symptom, and really just an improvement in your symptoms. So your cough shouldn't be worse, it should be better. Your fever should be gone for 3 days without you taking Tylenol, and it's been 7 days since you had that first symptom. Until those criteria are met, we really advise you, as feasibly as possible, try to remain physically distant. And gosh, do I know that that's hard? Yes. Oh my gosh, yes. All you want to do is cuddle your baby, and your first instinct when your infant cries is you rush over to them. But this is where, if I could find the silver lining, maybe this is where dad really steps in, because he didn't have that time with the baby in the hospital. This is where he can kind of step in and be that person, because you have to physically distance yourself. Mm-hmm. Do I think that's easy? No. I think it's really hard. And I think these are really unprecedented times, but that's the kind of guidance that we as pediatricians can give to you if you were to kind of expect going forward what the hospital sort of scene and going home scene is going to look like for you.
It's super helpful to hear, because I think there's just a lot of anxiety and a lot of nervous moms right now. And I think that just gives a little ease to it, because it's we really have to just own what we can do and be in control of that. Thank you for just taking the time and answering all these questions. I feel like I learned a lot. And so I know this will help just inform so many of the moms that follow us and watch our page. But can you also mention where our moms can find you if they have any other questions, to check out your posts and everything as well?
Yeah, absolutely. So I have been doing quite a few updates, trying to doing it regularly a few times a week, if not a few times a day. I'm posting a lot of my updates onto Instagram and Facebook. So on Facebook, it's at Pure Direct Pediatrics. So PUREDIRECT Pediatrics with an S. You can always send me a message through there. I'm usually very available to my families and patients and anybody who's interested. And Instagram, you can find me there on at Dr. Amna Husain. So DrAmnaHusai.
Well, again, thank you so much. I mean, this is such a big topic right now, and I was so glad when I found you.
Thanks so much for watching this episode with Dr. Amna Husain. I hope you guys were able to take away some awesome information. I know I was. I learned a ton. And like she mentioned, if you want to ask her any other questions or follow up, you can check her out on Instagram and Facebook at Amna Husain. She's also at Pure Direct Pediatrics. So check her out there. She does weekly videos about COVID and other important information as it comes to your children. So thanks again for tuning in, and we will see you next week.
Thanks for tuning in to this episode of Mom Talks with Christa. If you're not yet subscribed, go ahead and click on the subscribe button. It should be down here somewhere. We release new episodes every single Wednesday, and if you're not following us yet, be sure to follow us at Mommy Knows Best on Instagram. And remember, if you're watching this and doubting yourself, you are a great mom. So thanks so much for watching, and we will see you next week.